Hello, and welcome to the podcast. I'm your host, Robin, from Back to Your Roots Herbs. We're so glad you're joining us today. So many of us are walking through life carrying a heavy weight. It's that constant hum of worry in the background, that feeling of being perpetually on edge, that tightness in your chest before a big meeting or a difficult conversation. Anxiety is a deeply human experience, but when it starts to color every part of your day, it can feel incredibly isolating. For centuries, people have turned to the natural world for support, and today, modern science is finally catching up, giving us a clear, evidence-based understanding of how certain plants can help bring our nervous systems back into balance. Today, we're going to talk about the top 5 most clinically backed herbs for anxiety. We'll explore not just what they are, but how they work, and most importantly, who they might be best for. Because your anxiety isn't one size fits all, and neither is the support you deserve. Before we get to our list, it's helpful to understand a little about what's happening in the body during a state of anxiety. Think of it like your body's alarm system being stuck in the on position. 2 key systems are often involved. First is what's called the HPA axis, the hypothalamic pituitary adrenal axis. This is your core stress response system. When you perceive a threat, it releases a cascade of hormones ending with cortisol, the famous stress hormone. In short bursts, this is great. It prepares you for fight or flight. But when you're under chronic stress, this system can become dysregulated, leading to persistently high cortisol levels that leave you feeling wired, tired, and anxious. Some herbs, known as adaptogens, are brilliant at helping to modulate and normalize this very system. The second is the GABAergic system. GABA is your brain's primary brake pedal. It's an inhibitory neurotransmitter that tells your neurons to slow down, to stop firing so rapidly. This action is what promotes calmness, reduces muscle tension, and eases that feeling of being overwhelmed. Many effective herbal remedies work by enhancing the natural action of GABA, essentially helping your body press its own brake pedal more effectively. Understanding these pathways helps us see that these herbs aren't just folklore. They are sophisticated botanicals interacting with our specific neurobiology. So let's get into it. Our first herb is a true powerhouse for chronic stress. Number 1, Ashwagandha, the adaptogenic stabilizer. If your anxiety feels like a slow burn, that constant feeling of being overwhelmed by a never-ending to-do list, of being hypervigilant to every email notification, and being unable to truly switch off after work, then ashwagandha might be the herb for you. It's a cornerstone of Ayurvedic medicine, prized for its ability to restore vitality. Its primary power lies in its role as an adaptogen. Adaptogens don't push your body in one direction. Instead, they help your body adapt to stress. Ashwagandha's main mechanism is regulating that HPA axis we just talked about. In states of chronic stress, it has been shown in clinical trials to significantly reduce serum cortisol levels. It doesn't just sedate you, it helps to fundamentally normalize your body's stress response over time. Think of it this way. It's not a quick fix for a panic attack. It's a long-term stabilizer for the cumulative burden of modern life. The clinical evidence is really robust. A 2021 systematic review of multiple high-quality human trials found that over 6 to 8 weeks, ashwagandha supplementation led to a statistically significant reduction in stress and anxiety levels, along with decreased fatigue. The most consistently effective dosage range in these studies is between 300 to 600 milligrams of a standardized extract per day, often split into 2 doses. It's critical to look for standardized extracts like KSM66 or Sensoril, as these are the forms used in the research, and ensure you're getting a consistent therapeutic dose of the active compounds, called withanolides. As for safety, ashwagandha is generally well tolerated. However, it may increase thyroid hormone production, so individuals with thyroid disorders should use it with caution and under medical supervision. It should also be avoided during pregnancy. So, if you're that 45-year-old executive who feels less reactive to workplace pressures after a month of use, who can finally disengage from work in the evenings, that's the magic of ashwagandha. It builds resilience from the inside out. Number 2, lavender, the neurological calming agent. Now, when I say lavender, you might be thinking of aromatherapy or calming pillow sprays. And while those are lovely, the most compelling scientific evidence for anxiety comes from a specific, standardized oral preparation of lavender essential oil delivered in a capsule. This pharmaceutical-grade preparation is known as Silexan. This is for the person with more persistent generalized anxiety, the constant worry, restlessness, and even the physical muscle tension that comes with it. The clinical data for Silexan is exceptionally strong, with multiple studies showing its efficacy is comparable to conventional anti-anxiety medications, but with a much more favorable safety profile. Its mechanism is also quite unique. For years, it was assumed lavender worked on the GABA system like many other calming herbs, but recent research shows its primary effect is inhibiting voltage-dependent calcium channels in the brain. In simple terms, it reduces the release of excitatory neurotransmitters, effectively turning down the volume on the hyperactive signaling that characterizes anxiety. It calms the nervous system without causing the sedation, dependency, or cognitive fogginess associated with some other options. One landmark clinical trial directly compared Silexan to a low dose of the benzodiazepine lorazepam, or Ativan, in adults with generalized anxiety disorder. The study found that the oral lavender was equally effective in reducing anxiety symptoms. The clinically validated dosage is 80 to 160 milligrams per day. Imagine a 38-year-old teacher with a GAD diagnosis. They're hesitant to take a conventional medication because they can't afford to be drowsy or foggy while teaching. After a few weeks on oral lavender, they experience a notable decrease in both the mental worry and the physical tension, but remain sharp and clear-headed in the classroom. That's the unique position Silexan holds, clinically validated relief without the trade-offs. A key safety note: because of a potential for hormonal disruption, it's recommended to avoid oral lavender in children and adolescents, especially young boys. Number 3, Passionflower, the gentle Nervine. Passionflower is a beautiful, intricate climbing vine, and its action on the nervous system is just as elegant. It's traditionally classified as a nervine, an agent that soothes and tones the nervous system. This herb is especially beneficial for anxiety characterized by circular thinking or repetitive worry loops. You know that feeling when your mind gets stuck on an anxious thought and you just can't get off the hamster wheel? That's where Passionflower shines. By quieting that mental chatter, it's also an incredibly effective remedy for insomnia that stems from an inability to calm the mind at bedtime. Its mechanism is more straightforward. It works directly on the GABA system. The active flavonoids in Passionflower bind to the same receptors in the brain as potent pharmaceuticals like Valium, enhancing the calming effect of GABA. But it does so more gently. It's often described as a gentle benzodiazepine because it delivers therapeutic benefits without the significant drawbacks of dependency or severe cognitive impairment. The clinical evidence is strong. One landmark study directly compared a liquid extract of Passionflower to the drug oxazepam for patients with GAD. Over 4 weeks, both treatments were found to be equally effective at reducing anxiety symptoms. The crucial difference? The oxazepam group reported a significantly higher incidence of job performance impairment, a side effect not seen with Passionflower. Think of a graduate student in the days leading up to a final exam. Their anxiety manifests as racing thoughts, making it impossible to fall asleep. They take a capsule of standardized Passionflower extract about 90 minutes before bed. They report a noticeable quieting of those worry loops, allowing them to fall asleep more quickly, and they feel calmer and more focused on the day of the presentation without any next-day grogginess. Dosages in clinical trials have ranged from 250 to 900 milligrams a day. It has a remarkably high safety profile, though it should be avoided during pregnancy. Number 4, Chamomile, the systemic soother. Chamomile is probably the most famous calming tea in the world, but its true therapeutic value for anxiety, especially when used as a standardized extract in capsule form, is often underappreciated. Chamomile's strength isn't necessarily in stopping an acute panic attack in its tracks. Rather, its value lies in its role as a long-term systemic soothing agent for managing chronic, mild to moderate anxiety. The primary active compound, apigenin, is a flavonoid that binds to those same GABA receptors in the brain, producing a gentle, calming effect without significant sedation. The most profound research on chamomile comes from a series of studies on its long-term use for generalized anxiety disorder. In one ambitious study, patients who had responded well to chamomile therapy were then randomized to either continue with it or switch to a placebo. The results were fascinating. Chamomile didn't necessarily prevent a relapse from happening altogether, but, and this is the key, for the participants who did experience a relapse of their GAD symptoms, Those taking chamomile had symptoms that were significantly less severe. This suggests that chamomile's primary role is as a buffer or a dampener on the nervous system. It may not prevent stressful events from occurring, but it appears to lessen their physiological and psychological impact, promoting greater resilience over time. So imagine a 52-year-old woman who has managed her anxiety for years, but still experiences periodic flare-ups during times of high stress. She starts a daily regimen of standardized chamomile extract. Over the next 6 months, she notices that when a stressful event happens, a family illness, a work deadline, the resulting anxiety is less intense, shorter in duration, and more manageable than it was before. She just feels more resilient. That is the unique, foundational role of chamomile. The most significant risk is the potential for allergic reactions, as it's in the same family as ragweed. It can also interact with blood-thinning medications. And finally, number 5, Kava, the potent but controversial anxiolytic. Of all the herbs we've discussed, Kava is arguably the most potent, the most rapid-acting, and also the most controversial. For acute situational anxiety, think intense stage fright, a fear of flying, or a panic attack, Kava is incredibly effective. Its mechanism is powerful, primarily by enhancing the effects of GABA, but through a binding site that is distinct from benzodiazepines. It also blocks certain ion channels, which contributes to its muscle relaxant properties. The effect is a state of calm, sociability, and relaxation, often felt within just 15 to 30 minutes. However, its potency is shadowed by a significant and well-documented safety concern, the risk of severe liver damage or hepatotoxicity. This is not something to be taken lightly. But the story is more nuanced than simply Kava is dangerous. A prevailing scientific theory, called the preparation hypothesis, suggests that the liver damage is not inherent to the Kava plant itself, but is an artifact of modern Western industrial processing. Traditionally, Pacific Islanders have safely consumed Kava for centuries by using only cold water extraction of the plant's root. This method extracts the water-soluble active compounds, called kavalactones, while leaving behind potentially harmful constituents. In contrast, many early Western supplements used powerful chemical solvents like ethanol or acetone and included the leaves and stems of the plant, which may contain higher concentrations of liver-toxic compounds. This distinction is critical. The risk comes from the formulation. Therefore, the only appropriate use case for Kava is as a potent tool for acute, occasional anxiety, used under strict medical supervision, with careful attention to product quality. You must ensure the product is verified to be made from a noble cultivar, using only water extraction of the root. It should never be combined with alcohol or other substances known to be taxing on the liver. This is for the musician who experiences a racing heart and trembling hands 30 minutes before a performance. A single, standardized, properly sourced dose of Kava allows them to perform with a sense of calm focus. This use is strictly limited to a few times per month, with a protocol for regular safety monitoring. It is a powerful tool, but one that demands the utmost respect and diligence. So there we have it, 5 powerful herbs, each with a unique profile. For chronic stress and that wired and tired feeling, ashwagandha builds resilience over time. For persistent, generalized worry, oral lavender in the form of Silexan offers clinically proven relief without sedation. For those circular thoughts and worry loops, Passionflower gently calms the mind. For long-term management and building a buffer against life's stressors, chamomile is a safe systemic soother. And for acute, intense moments of anxiety, Kava is a potent, rapid-acting option that requires significant caution and supervision. Choosing the right herbal support is about matching the herb's specific profile to your unique experience of anxiety. Thank you so much for listening. To learn more, please visit us at backtoyourrootsherbs.com. The direct link for more information on the 5 best herbal supplements for anxiety is in the description below. Until next time, be well.